Hi, everyone. My name's Dr. Krista Burris, and I'm here with Dr. Mike Kim, and we're from
Hey,
Coachella Valley Direct Primary Care. Today, I believe, is the 23rd, or 24th. Yes, 24th of February of 2021, and we're going to talk about the state of Coachella Valley's coronavirus epidemic, as
how are
well
you
as
doing today?
how am I doing?
I said, how are you doing today?
Oh, overall, pretty good. How about you?
Yeah, I think today's been a good day. Numbers are looking better. We'll get into those in a little bit. Um, but it's been hot. Like we were talking about, my car registered 106 degrees Fahrenheit in the sun today.
Yeah, I don't know if we should talk about this too publicly because there's still quite a bit of the country that's down around zero, but it is maybe worth enjoying while we have nice weather because in the summer here it does get really hot. So it's good for us to enjoy our nice weather,
Oh,
even
for
though it's the
sure.
opposite of most of the rest of the country. Speaking of that though, that does bring up a question, that as we move back into summer or into the springtime here, it's really our season to get out. And a lot of the stuff that happens in the Coachella Valley happens this time of year. So, our music festivals, our sporting events, a lot of that has been canceled for 2021 or postponed. So we're in this state right now where normally it's very busy here and it's busier than it was over the winter, but it's still, not what it normally is. And so we're going to look at the numbers today and see how it's looking for the fall and next spring to see if we can forecast a little bit where we're going to be at that point and um, whether we're really out of it or not. So let's go ahead and start with that first slide. This is our statewide metrics, and we'll go and look at Riverside County in particular. And we are back in the tier system. And what you'll see for Riverside County is a marked improvement of where we were even a few weeks ago. But the thing that's really important to mark here is our rates per 100,000, and we're at 16.2. And we're going to come back to that a little later because that's under 25. And that means that the schools are now allowed to reopen in the elementary age. The middle and high schools will not be allowed to reopen until that number gets 7 or less. So we've hit that first benchmark of going under 25, and now we're in a period of time where the elementary schools are allowed to reopen, but we need to get under 7 for the upper schools. And then also, if you remember, that rate to get into the red tier needs to be less than 7. So we've got a ways to go to get there, but hopefully we'll get there sometime in the next month. That positivity rate, though, we are at 7.6% positivity for our county and 8.3% for our equity quartile. That is, remember, the highest rates are usually found in the most disadvantaged communities, and we want to make sure we don't leave those communities behind. And so, in order to go down to the red tier, that health equity quartile needs to get to less than 8%. And it's very close. So, in this regard, we've almost met criteria to move to the red tier. We just need that cases per 100,000 to fall below the 7. So that's where we are for our county. Let's go to the next slide. This one is our daily epidemiology study. And what you'll see here is this is for yesterday. Again, our cases are still hovering at around 12,000 of the rapid antigen and about 300 new cases. This is a significant improvement. Even though those rapid antigen cases remain high, again, some of those are duplicate numbers, and so it's hard to really figure out where we are just from those probable cases. But our new cases by PCR have dramatically fallen. I don't know if you remember back in January, we were seeing new cases sometimes over 10,000 a day. So much improved. And let's go ahead down. And we'll look at some of the graphs. Let's go down to the very bottom one. It's probably as good as any. So what we're going to see here is our positivity rates on our testing. And what you can see is that our positivity rate is continuing to come down. We're at that 8.3, like we had mentioned before. But the trajectory continues to drop, and we are not quite back where we were in October, end of September, when we hit our nadir on that curve. But we're trending in the right direction. And let's look at the last slide, and then we'll talk about what some of this means. This is our Riverside County District 4 weekly report for the Coachella Valley. And this is also showing the same pattern that we've seen on our other graphs of continuing the drop, the numbers of cases. We're coming down that backside of the curve very rapidly, and our doubling times have gone back up. They were down in the 30s, and now we're back up to 65 days. All these are trends. We're not seeing any outlier numbers here. Everything's trending the same direction, which is reduced transmission. So let's go down a bit. You'll see our hospitalizations in the valley are continuing to gradually go down. Our total number of patients hospitalized is under 90 now among the 3 hospitals, and our ICU admissions are also continuing to drop. Our valley-wide positivity rate is 5.8, which is great. We're doing really well. What we want to make sure we do is maintain our testing surveillance. One of the potentials for things to kind of spiral out of control again is if we spend all of our resources vaccinating and don't continue to do our surveillance testing, there's always a chance that another surge can sneak up on us unawares, especially with the new variants out there. So we'll have to make sure that the numbers of testing don't fall so low that we're not aware if a surge is starting. So it's something to keep an eye on. It's normal when there's more disease transmission for our testing numbers to go up. There's more demand for testing and there's more need for testing, but there should be a basic number below which we do not fall as far as the number of tests that are being done in order to maintain that appropriate surveillance. Okay. So that's it for the slides. Um, when I was looking at this, you and I were talking earlier about how some people may feel that their actions, what they've been doing to try to mitigate their risk and protect the community, it seems to be completely divorced from what the virus is doing. So I've been doing the same thing all year. I've been staying home. I haven't been going to meet with my friends. I've been wearing my mask in public. I've been washing my hands. I've been doing things outside. And I've done the same thing all year. And yet this virus has gone up and down. And I think for a lot of people, they feel like, well, what's the point? Because I've been doing the right things. My neighbor's been ignoring all the advice, and the virus just seems to do what they want. Why should I keep doing this when it seems like I'm suffering and my neighbor just does whatever they feel like and the virus just does whatever it feels like? How do you answer somebody like that, Mike?
Those are good questions. I guess to break it down, there's a lot of things that are involved. Now that we've been through a year's worth of the virus, I was just looking at the graphs. If you look back, I mean, there are certain months where it went higher and certain months it went lower. And I think there's a lot of factors involved. Like I was looking back, back in March, April, May, that's when there was a little climb and then went back down in the summer. And then we had that August, September, and it spiked up to November, December, went down. So the question becomes is, are we going to follow that pattern again? And I think the answer is we don't know. There's a lot of different things going on right now, right? More people have gotten the coronavirus. The vaccine is rolling out. But then on the other side, we have all these variants coming out that are easier to get, and you get sicker quicker. And so how does that all play out? We don't know. But I think the question is, it's hard to use our five senses to do all the things that are going to be right. And by that I mean is there was a very interesting Hidden Brain on NPR about things that people are afraid of, and are they afraid of the appropriate things. And the classic example is Jaws, right? When Jaws came out, and still to this day, most people are afraid that if I go to the beach, I'm going to be eaten by a shark. And that happens so rarely. We should be more afraid of the car ride going to the beach, because you're far likely to die in a car accident or get seriously injured than you are about getting eaten by a shark. Yet that's what most people are afraid of, and it's only because of what that movie did and kind of what the senses that it invokes and everything. So I think the coronavirus is kind of the same. The impact of what we do is not felt on a day-to-day basis. It's a trend. It's a public I guess as a group, what we do affects everyone, and so individually it's hard to see what I'm doing really affecting other people or other parts of the country. And so it's a very much of a disconnect.
Yeah, I look at the graphs and I can see it as a public health person. It's like we had this huge winter surge, which by the way, we're still clocking a couple thousand deaths a day in the United States from our winter surge. But the surge was predictable because we all as a country at the same time did risky things, which was gathered together in indoors in family groups a couple times in a row um, during the holidays. And it didn't mean everyone did it, but enough people did it that it drove this surge. And so, one of the things that I think is hard for people to understand is that even though their small part in either promoting disease transmission or preventing the disease transmission, they may not see the impact of that directly, but it occurs. It's almost like you have a wooden fence, and it's just a rickety old fence. And if you lean against it by yourself, you don't really knock it over. But if you got 1,000 of your friends and you all leaned against that fence, it goes straight over. So the idea that my small behavior is somehow associated with these larger forces around me, even though I can't see the actual connection, I think is tricky for us. Um, like it's like throwing a penny in a fountain, but we can see the understanding, in some ways. Like if we're doing a GoFundMe and we're giving $5 and we manage to raise $1,000, it's like, wow, look what we did together. And you can understand I'm a part of that. And I'm hoping that people kind of connect with this pandemic that way, of my choice not to go to this dinner party, or my choice to move this activity outdoors and space it out a little, or my choice to wear a mask around people who aren't in my household. All these little things, you may never see the actual fruit of that decision, but it's there. And as we head into this next season, I think helping people to understand that behavior matters is going to be really, really critical, because we have the opportunity right now on this downward trend. If we can prevent this summer surge of going into the fall and having things look pretty normal, if we don't prevent transmission and these more contagious variants manage to take hold, we're likely looking at another summer surge just like we had last year, which means we will not be returning to normal in the fall. And we are so close that I'm so worried that people are letting down their guards way more than we really should be.
Yeah, no, I agree. We are moving into maybe the red tier. We're moving into elementary schools opening up. So more people are going to be moving about. And I think if we're not careful, this is the precipice of where, if we stay vigilant, enjoy the fact that we can go more places, do more things, have the kids out there, but not take that as a, well, now we can do everything, then I think we can continue the trend going down. And as the vaccine continues to roll out, and I know we'll talk about the Johnson and Johnson vaccine, that's going to be a help. We can get over the tipping point of going back to a surge, but we're right at that point where if people aren't careful enough, we were there once. We were in the red zone. We went right back into the purple zone, and
Yeah, I
so
don't know if
we
people remember, we were in the red zone for 2 weeks before we are back in the purple zone. So
right.
it's eh, you know,
So
it's like,
everything is going the right way, but it doesn't mean it can't go the other way. So I think we just want people to be, if 2, 3, 4 more months of really being diligent, and we can then be pretty sure that we'll continue that way, or at least have a lower transmission. But if we don't do the right things now, we're gonna have those bumpy rides again, like we did last year.
yeah, as a parent, I can't imagine anything more discouraging than having a surge this summer and not being able to go back to school in the fall. I mean, it does not even bear thought at this moment, because that just, it would be so harmful on so many levels. Um, so let's talk about the Johnson and Johnson vaccine. The J&J vaccine, this Friday, the FDA has a meeting of they are expected to recommend authorizing an emergency use authorization. So once it has been recommended for the EUA, the FDA actually has to approve it. So there's a committee that meets this Friday, and then the FDA would approve it. Once that happens, it goes to the CDC, and there's a committee there called ACIP, which this is the committee at the CDC that makes recommendations on how vaccines are used in the United States. So they're calling a special meeting, anticipating that they're going to be reviewing the J&J vaccine on February 28th. And they have another meeting, I believe, scheduled for March 1st in case they need a second day. So once the CDC goes through their process, they'll make the recommendation on how the vaccine is going to be used. And once they've done that, it should be able to roll out. J&J says they have about 7 million doses ready to go. So this is not a tremendous number this first week, but hopefully they will continue to increase production. They were anticipating about 100 million doses available by the end of spring. So end of spring meaning end of April. So we'll see how quickly they can gear up. Also, how the CDC recommends this vaccine be used, because this is a vaccine that might be really helpful in certain populations, like people who are hard to get back for a second shot. So, our transient populations, or people who it's difficult for them to get away and come. It's also easier to store this vaccine. It can be stored in a fridge, I believe, for like 6 months. So this is a vaccine that would travel very easily out to more remote areas. Also, areas where you may need to go um, to several small towns to do vaccination. You could easily do that with this vaccine. So I'm excited because I feel like it's a useful armament, but we may not see it roll out the same way that Pfizer and Moderna rolled out. It may not just be Pfizer, Moderna, or J&J. They may actually send the Johnson and Johnson vaccine to very specific locations. We'll just have to wait and see what they recommend.
Yeah, no, I think it will open up lots of groups quicker, because you can send them directly to the pharmacies and the clinics, because even our clinic has the ability to store it, versus
Right.
the Pfizer and the Moderna are a little harder. So I think it will speed up the vaccination process. Um, and then, do you know, have they talked any more about their? Because I know they were looking at what a second dose of the J&J would do. If that booster would increase it more, or is it superfluous? Or
Yes, so there was interest in whether if they turned this vaccine into a two-dose vaccine, like if they gave a booster dose, would it improve its efficacy, which is at about 66% good at preventing disease. It's about 80-ish% good at preventing severe disease. So it's really a good vaccine, but it's not quite as good as the 95 that Moderna and Pfizer got. So they're doing that study right now, and the results of that study are due out in November. So we'll have to wait a little while to know the answer to that question. Also, something to keep in mind is the J&J vaccine was studied against a lot of the variants, and the Pfizer and Moderna primarily were studied against the original strain. So what we're seeing right now circulating in the community is a lot of variants. So both Pfizer and Moderna have gone back and are currently doing studies looking at their vaccine against the current circulating strains. So we also should see some numbers coming out from that in a couple months as well. I wanted to talk about the school thing. Because our rates per 100,000 had gone under 25 for more than 5 days in a row, we now qualify as a county to reopen um, our K through 6 schools. So I wanted to ask you what you thought about that, what you've heard about how that may sort of transition out into real life. Like, what does that really mean?
yeah, so I think the quickest district is the Desert Sands. I think they're going to open up there. I think in March. They were thinking in March 8th, but realistically, probably it'll be later March, and the middle or end of March. I would suspect, because it's just to get every part moving again after a year of not moving is going to be hard. But what I heard they're doing is they're going to be doing a hybrid model where half the teachers in the grade will be on campus and the others will be only online. And so it'll be something like a Monday, Tuesday, one group will be going, Wednesday will be all online, and then Thursday, Friday, the other group goes. And so it'll be so that you're splitting up cohorts, so to speak. And so, on top of everything else that they are required to do per the CDC. in terms of cleaning and ventilation. And so, that becomes, I know, is part of the issue. Is I know there are going to be schools out there that just they can't afford the ventilation system, they can't afford the social distancing as much as other schools, and so that's a problem. And the other problem is, how do you continually monitor the mask wearing and the social distancing? And then also, you're still going to be, hopefully as the rates continue to go down, it won't be as a big deal, but, we're still in the purple tier. So there are going to be families that are positive, and then, does that mean that pod goes out, and then what happens if they go back online? So there's always going to be this in and out of the school. And is that, even though it's better because they're in school, more just as disruptive as if everyone's online? So I don't think we know that.
Yeah. There's definitely no perfect answer to this, and I don't think there's going to be a perfect solution. Also, I do want to highlight, although the governor said, the rules changed so that K through 6 can open, the way that our schools are designed here in the Coachella Valley, it will probably be K through 5, because 6th grade is usually combined in with the middle school. So what we'll probably see is K through 5, and then 6th grade will have to wait until the middle school itself is given the all clear, which hopefully will happen in the next few weeks, but we'll have to wait and see what if those rates continue to drop. One other thing that we've been talking about is, the funding for the schools to make the modifications. Certainly, some of it has been received, but not all. A lot of the increased costs have to do with increased staffing, because you need more people to make all these things work. And one of the ways that I was hoping that they'll invest in this is to increase the amount of school nurses, because you do need somebody who's actually available to help, deal with the day-to-day questions that arise, day-to-day, issues with students, as far as, what does the symptom mean? Is this a fever or not? Is this child, is this a stomach ache? Do they have to go home? If they do go home, when can they come back? And a lot of that is, some of it's clear and sometimes it's not so clear. So being able to apply the rules and regulations in a way that's common sense is a skill, and school nurses are good at that.
And I know there's some schools that, like DCA, our 10-year-olds going there, and they're not a large school, but they have an elaborate process of checking in. So I can't imagine, if you triple the size of that school to a public school, how is that going to look like? Because I do think you need some kind of check-in system, because human nature is people will send their kids with fevers. I mean, we know that happens even pre-pandemic, and we don't want that to happen during a pandemic. So, how does that look? And so, I think it is a good idea, and I think we're getting to the point where you can send it, but that's only with the caveat that our community understands, if this is what we want for our kids, then we have to be very diligent on keeping the other parts of society and our social distancing when they're not in school intact, or it'll all blow up.
Yeah, I still think, getting our kids back to school in a way that is doable, just given all of the things we just talked about, all the complicated things, and human nature, and the real complexities of families' lives and work schedules. The community transmission rate really just needs to be driven down. And the faster we vaccinate, the more we adhere to um, the same, things we've been doing, the faster we get back to school in a safe manner.
Right.
So I'd really love to see everyone back by the end of the school year. But what I don't want to see is total chaos, which, going back and then having to go virtual again would just be, super disruptive. Um, I know the LA school system is working to bring back their highest need children only. So that's children with special needs or children in very limited social situations where say they don't have access to Wi-Fi, where they really need to be in school in order to complete their work, and being able to bring those kids back in immediately in a safer way because there were less kids in the school at one time, um, is the approach that they've taken. So it's different from what we're doing out here, but it's, it's interesting to watch how different people try to meet the needs and solve the problems. And it's easy to criticize, and I'd just like to give a shout out to all the people who are really trying, because there is no way to do this perfectly. Um, and it is hard as a parent to advocate for your child and do the best thing for them when you know, like, it's impossible to get everything perfect.
So I think we need to wrap up because we have another show. We ran a
Okay.
little bit over time, but um, please join us for our next show where we talk about your personal health and what it means. Please join us next week. We'll be back. Hopefully, there'll be continue to be good news, and stay safe out there. And we will see you hopefully in a few minutes.
Bye, everyone.